Dr. Zaheer Shah, who joins us now live from Tempe, Arizona. He's a hospitalist and a board-certified internal medicine specialist. Dr. Shah, it's really great to have you back. It's not just happening in the U.S., it's also happening in Europe, and we're seeing a lot of countries right now return to these restrictions. What is driving the spike in cases that we're seeing not just in Europe, but also here in the United States?
Well, Kilmany, like most other questions entailing COVID-19, the answer is not straightforward. We know that there have been instances, especially I can speak to the United States, where the governmental response as well as the population response to COVID-19 with respect to social isolation, the use of masks and other protective equipment has not been to the level that it was necessary to control the spread of the virus. And unfortunately, as the information that moves back and forth on the interwebs changes, people's response to it and the way that they protect themselves and others continues to oscillate up and down. I think what we're seeing now is another wave of COVID-19 occurring, at least in the United States, because of an overall lax approach to the pandemic. I do think that the developments in the White House have been really sobering for Americans because, as you, I think, are aware, our president has been at the forefront of mitigating and diminishing the significance of this global pandemic and also advocating for alternative therapies that, ironically, he himself did not receive when he contracted COVID-19. But now that he's had COVID-19, his wife, the First Lady, has had COVID-19, and now Barron, their son that lives with them, also has contracted it. I think even some of the most diehard individuals in this country that minimize or dismiss the severity or the significance of COVID-19 have been forced to reevaluate. And I'm hopeful as a result of that, that we're going to see this concerning upswing in the number of cases go back down.
And of course, Dr. Shah, the U.S. Center for Disease Control and Prevention had warned about the confluence of having both coronavirus cases and the flu at the same time. As somebody that practices medicine every day, how do you differentiate between the two, and how big is the problem with those two coinciding with each other?
Well, we don't differentiate clinically very well because the symptoms overlap in such a wide variety of ways. And I'm very fearful of what this fall is going to bring to many segments of the population in this country, because we're talking about a perfect storm. We're talking about what we know occurs every year, which is rates of influenza go up significantly during the fall months and early winter months. And the general rule with the influenza is that it always weakens your immune system. It always weakens your defenses. So if we have a seasonal viral infection that does that, coupled with an ongoing persistence of COVID-19, which is a coronavirus different from the influenza virus that we deal with every year, we could be dealing with a significant uptick in the number of patients that end up hospitalized with COVID-19, and God forbid the number of individuals who end up dying from a combination of COVID-19 and influenza.
Dr. Shah, what needs to be done at the federal and local level to manage the increase in cases that we're seeing?
Well, Kilmany, we are living in what in my lifetime, I've never seen. We are living in an age where science itself is being attacked, where scientific experts' recommendations are being casually dismissed by laypersons all over the country. I think that leadership has been a critical part of this disinformation. I think we need to get our leadership right. We need to speak from the White House on down about the seriousness of the matter and about the measures that we have to follow. I mean, for God's sake, when the White House itself and other members of our leadership don't follow the recommendations of their own CDC, I don't know what we can expect from the average person on the street. And we have to change that in order to combat this. So it's not even so much about high-tech solutions or about new therapies. We have to begin fundamentally by embracing the science of this pandemic and adopting those safety measures that have been recommended by those that are truly experts.
Dr. Shah, it's been great to have you back. We really appreciate your analysis as always. Thanks for that.